Welcome to Mahaska Health Medical Minute, where we will talk with your local trusted experts to bring important healthcare topics for you, your family, and our community. Thank you for joining us today. My name is Renee Edgar, registered nurse here at Mahaska Health, and I'll be your host for this episode. Today on Mahaska Health Medical Minute, we will welcome back Chief Medical Officer, board certified in general surgery, and fellow of the American College of Surgeons, Dr. Tim Breon. Along with him, very honored and excited to have physician assistant Rachel Sheets to talk about some great healthcare topics. Good morning, you guys.
Good morning.
Both of you have had an incredible impact on the community, not only through your mission of expert patient care, which we see every day, but in your personal life as well. What are some things each of you enjoy about our community?
Just a great community. We really appreciate the people that are here. And so we have great patients, and also it's just a great place to raise a family. So these communities are just wonderful places to have your children, and there's so many things that they can be involved in that are just healthy, wholesome things for children and families to do. Knowing the people that are here and growing up locally, I grew up 30 miles from here, but growing up locally, you're just familiar with it, and it's just kind of the kind of people that you're accustomed to being around, and so you can relate with them very well. They can relate with us, I believe, very well. And so I think those are just great bonuses. And
tell us now, currently, the community that you live in. It is here in Mahaska County, in Oskaloosa.
It's here in Oskaloosa.
What do you
love?
love?
I love it.
Good.
I love that it's such a tight-knit community where everyone is friendly. They've been welcoming since day one, since I moved here. It's not uncommon for you to run into someone that you know at your local market or at Smoky Row Coffee. It's just a really great community, like Dr. Breon said, and I'm looking forward to raising my own family here someday.
Wonderful. Tell us about you. You're from Ohio.
Yes.
Tell us your journey.
It's kind of a different story. So I'm from and grew up in southeastern Ohio. Went to school there and started my training there right out of PA school. And I chose a surgical specialty initially. I'd worked in cardiothoracic surgery because I enjoyed anatomy so much in college and in my training. And so I just loved every aspect about being hands-on and learning and about different, organ systems and actually getting to visualize, yourself helping out a patient right then and there through the, art of surgery. And so I knew that I wanted to do that for the long haul. How I ended up in Iowa was because my husband is actually from here. He's from Iowa, Kyoto, actually. And so that's ultimately what led me to move to Iowa, was so we could be together. So, as far as landing here at Mahaska Health, it just all kind of fell in my lap and worked out. And I have God to thank for that, because I honestly wasn't sure where I was going to end up. Moving to a new location, a new state for that matter, is very scary, and it comes with a lot of anxiety and uncertainty. But one thing led to another, and here I am, and I love it, and I couldn't imagine being anywhere else now. So
rural Iowa just continues to do great things for all of us.
It's wonderful.
Very relatable to all of our audience. What would you like to share with our audience today to encourage them in their health journey?
I think it's just being aware of your body. No one knows you better than yourself. And so if you can pay attention to, any changes or any new symptoms or just something that seems off, I think it's important to get that addressed by a healthcare provider, because it could be something, life-threatening or harmful, and it could be nothing, but it's worth getting, checked out and, have it looked over, just to have that connection and establish a relationship with your provider. So that way in the future, you can just follow up with them closely and be aware of any sort of change that, may come down the road.
Dr. Breon, overall GI health, including healthy fiber intake.
I think fiber and its role in colon health is really, I think, in the general public has been recognized in the last several years. And so people finally realize that. But for many years, I think it's been something that colorectal surgeons and colon surgeons and general surgeons in general understand, because we deal with the consequences of lack of fiber. And so we're kind of a developed country that's spoiled with lots of food. And so when you're blessed with lots of food, we deal with the consequences of that. And one of those consequences is diverticulitis and just irritation and inflammatory changes in the colon. And so many people just get high concentrations of really heavy concentrated meals that have lots of carbohydrates and fats and protein. And so none of us are starving at the same time. That also takes out a lot of the things that's really good for our colon, which is fiber. And fiber plays many roles, not to mention the least of which is just keeping our colon healthy and happy, reducing the risks for colon cancer, moves the contents of the colon through the colon a lot faster, so things are in contact with the lining of the colon a lot shorter periods of time if you're getting plenty of fiber. Reduces other diseases such as diverticulitis, diverticulosis, and the inflammatory condition of diverticulosis is diverticulitis. Perianal issues such as hemorrhoids and fissures and fistulas and abscesses and things that people can deal with, but they probably don't talk about it, but they certainly talk about it with us because that's why we see a lot of people.
Sure.
But people just lack an understanding of how important fiber is because it's just not been a big part of our diet. And when you realize that you can increase fiber in your diet, and when you understand what those kinds of foods are, and typically those foods are going to be things that start off dry. Many people think, well, I get a lot of fiber, I go to the salad bar, I eat lots of apples. But those things are mostly water, and so that you have to really have the dry component, which is fiber, to get that fiber. And you can't necessarily get that from one gummy fiber either, because I tell people often that fiber is a bulk. You can't make cookies with one flour pill. It takes a cup of flour or 2 cups of flour. And fiber is the same way. You need that bulk. You need that. And it needs to be the kind of fiber that we can utilize as humans, which is water-soluble fiber.
Okay.
If you get more fiber, then you don't eat as much typically. And when you get fiber early in the day, it can curb your appetite and can satisfy a lot more than just lots of other foods that are lacking in fiber. And also fiber has a huge role in just the way that our bodies deal with and process sugars, and the way that our insulin can work and produce insulin. So it even has a role in diabetes management. So, and it's kind of fun when you tell somebody about something as simple as fiber and fiber supplements and changing your diet. And once in a while we'll have people come back and they'll say, I don't know why somebody didn't tell me about that sooner, because that's really changed my life.
Sure.
Because people were struggling with constipation or just issues. And once they start doing that and making those changes for themselves and owning those changes themselves, they reap the benefits from that, and they appreciate that.
Tell us about your team.
Well, like I said, I feel as if my transition to Mahaska Health wouldn't have been possible if it weren't for the people that I do get to work with on a daily basis.
Great.
They've made, it's so great, easily to adapt to. They're very supportive. They've, always been there to help me if I had questions. I was getting familiar with the area and, just the hospital in general. And they're fun to be around, honestly. They know these patients, they've seen these patients for years and years. And so I'm kind of the new girl in town. And so they have these cute little stories that they'll tell me about each one that comes in. So I feel like I'm already establishing a good bond with my patients before I even meet them, because, we have a great team, I would say.
I think of lots of teams, that we have, but the team in the office is kind of a unique, special group of people because they've been together for so long. So I think to have any group of employees that can stick together for, I think Dr. Riggs, my partner, and his nurse have been together for over 30 years. And then my nurse is actually my sister, and we've been together the entire time that I've been here. And then our office receptionist and scheduler, Sherry Day, has been here longer than that as well. So still just a great group of people, and we work together well as a team. And then I think of those teams throughout the hospital, in the inpatient units and in the surgery department, and in all care areas of the hospital, and also other areas that support those care areas. They're just some really great teams. Mm-hmm. And I think those teams and those relationships and the interrelationships between those teams in our hospital has improved significantly over the last several years, just as our culture continues to improve. I think a lot of our patients come to us through primary care, but we also have lots of people that just call.
Yeah.
Great.
And so we'll take anybody, and especially if they need something.
Wonderful.
Yeah.
Sometimes people feel like they can't get into us because we maybe are busy or our schedule is that way, but oftentimes if somebody feels like they need to see us, they'll call us and we'll see them anytime. Mm-hmm. We provide coverage 24 hours a day, 7 days a week, 365 days a year.
Absolutely.
And so we have surgeons on call all the time, and so our main goal is to be available to take care of those needs when they're needed. In March it was Colon Cancer Awareness Month. And one of the things that we do here is colon cancer screening with colonoscopies, and also other methods that we use to check for colon cancer, stool tests and other things. But there have been so many people that have come in, and oftentimes it's some husband that his wife has been harping on him for years to get his screening colonoscopy, and they deny having any symptoms, and then when they come in, we find a colon cancer. And oftentimes it's just an early colon cancer, and it's quite overwhelming to them, and they didn't want to be here to begin with. And when you go ahead and develop a relationship with that person and you earn their trust, and they have you do the surgery that removes that colon cancer, and then you see them through oftentimes the chemotherapy, which we offer here with Dr. Hyatt as a medical oncologist, and we continue to see them, and we follow them for years for screening and surveillance colonoscopies thereafter. It's amazing how many of those people, within a year, you're seeing all their coworkers, you're seeing all their brothers and their sisters and their cousins, and they drag everybody in that they know, because all of a sudden that takes on real meaning. I think just a pitch for colon cancer screening, as it was Colon Cancer Awareness Month this month, but also just those meaningful relationships that you develop with people. Oftentimes when they come in against their own will, because their family drags them here, and then you find things that really changes their life. I mean, those are people that, had they not been here, would probably not have the same outcome and may not be around.
This truly comes down to communication and being real with your physician and talking. That's wonderful. Dr. Breon and Rachel, thank you again for coming in today for our Medical Minute. It was great to talk with you both about your roles here, as well as your passion for serving the needs of the family and really the whole individual. So thank you both.
Thank you.
Thank you.